Thompson from NOhep in Australia to talk about a nurse-led model of hep C care in prisons. And Alex is a hepatologist.
Thank you, Sue. And thanks for the invitation to speak today about our program. So in Australia, we have an epidemic of hepatitis C related to people who inject drugs, and we've treated the low-hanging fruit. So our clinic, the patients who are engaged in our clinics have now all been treated, and care really needs to move into the community to engage with people who won't come to the hospital. We have a big prison program in my state, so we have 8,000 prisoners in 14 prisons. Roughly half of prisoners have a history of injecting drug use and are in prison related to their injecting drug use, and about half of the prisoners with a history of injecting drug use are seropositive for hepatitis C. Before our program was started, prisoners would have to come to the hospital to access hepatitis C treatment. So if they were at one of the regional prisons, they would have to shift from a regional prison to the central prison, and from central prison to the hospital to see me to access their hepatitis C treatment, which was very efficient, and many prisoners would just refuse to come. So we have set up a decentralised nurse-led model of care in our state. So we have 2.5 full-time nurses, and they go out and they assess prisoners in their local prisons. They have a mobile fibre scan that they take with them. They follow a protocolised assessment process, and then they, using what we call a remote consultation, which is a very simple paper-based checkbox list, they identify prisoners who are suitable for treatment. And there are 3 hepatologists, so we have 0.2 EFT of hepatology support. We supervise the treatment. So we have evaluated the program to date. Amongst the first 400 prisoners, there were some interesting lessons learned. All of them had a history of injecting drug use. 90% of the prisoners were male. The 80% of the prisoners could start treatment without any doctor involvement at all. And only 20% needed to see one of us because they had advanced liver disease or they had a complex medical problem such as seizure medication that would potentially interfere with their hepatitis C treatment. Not surprisingly, the treatment is just as effective in prison as out of prison, so our cure rates are 95% within the prison system. We've now assessed more than 3,000 prisoners over the last 2 years. We've started treatment on more than 2,000 prisoners. And so it's a really successful way of engaging high numbers of people who are at risk of transmitting hepatitis C. So we think that's going to be one of the pillars that underpin our implementation effort in the state. So I'm happy to take any questions when we get to the discussion.